My name's Anne Sullivan. I'm 67 years old and I'm a theatre sister, or now we call us team leaders at Trafford General Hospital in theatres. I'm from Flixton, which is probably about a mile and a half down the road. That's where I grew up. I think that that in those days people came and they could stay up to 10 days, possibly longer, recovering from the surgery. My first ward was a surgical ward, and patients would come in and be in 7 to 10 days really, possibly longer. Nowadays they come in and they're gone home, usually on the day of surgery. Sometimes they stay for 2 to 3 days if it's a bigger procedure. I've always liked working with people, and before I started nursing I worked at a well-known chemist in Manchester, and I loved working with the people, dealing with people, and nursing had always appealed to me, and I just thought, well, I'd try and see how, give it a go. I was 18 when I decided, to apply for a nurse, and I was 19 when I started my training. Within the my nursing career, I think it was quite recent actually during COVID. The theatres here were closed, and we were all sent to various areas, departments. I was sent to Manchester Royal Infirmary, and I worked on the ITU unit for both lockdowns. We were looking after ventilated COVID patients, and it was really quite stressful because it's not something that we were taught to do. The staff there were very good, and they helped us as much as they could, and we learnt a lot. And when you become a nurse, it's something you sign up for. You sign up for doing things like that. You can't just pick and choose what you want. You have to support people no matter what and look after them. When I first started working in theatre, I knew that I'd love it. I just knew the day the minute I walked through the door, I loved it. And that was, since then, what I like about it is the teamwork, that everybody from different teams, surgeons, anaesthetists, radiographers, nurses, operating department practitioners, everybody works together as part of a team, and to know that you can actually help somebody improve their life is a good thing. You feel good about it. I think when things are challenging like they were during COVID, you just took one day at a time, one task at a time even sometimes. It's, you just have to work your way through your workload and do the best you can. And if there's people there that can help you, then yes, that's good. And people will help you. I think we have one of the best professions. People will always need nurses, and it may be that you are in an area where you're not too happy with, but there's going to be lots of other areas that you can go and work at, and some people wouldn't like working in the operating theatre, but I love it, and just give it a go. I feel sad if people leave nursing, because I think it's a great profession, and people will always need nurses. My first job was working, after qualifying, was working in A&E on night duty here at the hospital where I trained. But I also used to go into theatre and assist the surgeons if they had an emergency during the night. And I think it was then, you know, as soon as I walked into theatre, when I was first being orientated to it, I walked through the door, and that is what impressed me with theatre, everybody working together. Oh, the nurses' accommodation was probably not much bigger than this room. Everybody had their own room. I came from a very drafty Victorian house where in winter you would get ice on the inside of the windows. So I mean, it had central heating, and to me that was absolute heaven. And you could always, there were plenty of baths and showers, and you could always go and have a bath if you wanted, plenty of running hot water. But it wasn't just that, it was the companionship, the laughs we used to have in the nurses' home, the fun we shared, and it was also how everybody supported each other, and how we, you know, the local pub, we had our own table in there. And it was a big long table, and all the nurses, it's known as the nurses' table, and we'd just go in there, sit there, and nobody else ever sat there, and I don't know why, but it was just known as the nurses' table. She'd already been to university, and she'd already got her degree, but she didn't want to work in that field. And she said to me, I wish I'd have done nursing. So I says to her, well, why don't you work as a healthcare assistant on the wards looking after patients and see how you feel with that. So she applied for an apprenticeship, which she got, and started working at a very busy ward at Manchester Royal, an emergency admission ward, so you can imagine how busy it was. But she loved it from the word go. And I was so proud of her. She did her nurse training, and she's now working on the district, going about 20 odd visits a day, going round to see patients.